We are the Bachelor of Social Work program student. We are coming from Group S. Today we would like to presentation about organizations and Mpox. We have firstly, I want to definitions of urbanization. That means the process of large numbers of people moving from farming to cities. It's a key side of how modern communities have grown economically and socially. In 2050, the United Nations said that 6.72% of people will live in cities and that there will be 6.252 billion people living in cities around the world. Of urbanizations, the number of people living in cities will change in big ways. Urbanizations is the process of cities and towns getting bigger, which include building more facilities and do more business. Then resources and capital may move from farming to industry and service. At the same time, urban infrastructure like transportation, healthcare, and schooling grows and get better as more people move to cities. On the other hand, at the same time, the fast urbanization has some bad effects. It leads to urban disease, like social and environmental problems like traffic, pollution, and a lack of social connections. Infectious disease can be spread through physical contact, breathing, food, and water. This is a two-way relationship between urbanizations and infectious disease. More people living in small, crowded places make the environment worse, which makes it easier for disease to spread. Infectious disease can range from mild to serious and can even kill, especially in people whose immune systems are. Because of this, the close relationship between living in cities and the spread of deadly disease is our worry. As cities grow quickly, people are more likely to come into contact with wildlife. It seems that there have been lots of cases of mpox in the last few years because people are more likely to come into touch with each other in cities, where the virus can spread from people to people. So, making these conditions is very important to stop the spread of this disease. Public health agencies around the world have raised up the alarm about the rise in mpox cases in cities. In 2025, the WHO has received a report of 29,204 confirmed cases, and including 117 deaths. In this presentation, study mpox hopes to focus on public health problems caused by development and unfair health resources, especially in low-income areas. In addition, it makes people aware of problems with social unfairness, with inspires them to act. It also talks about how important it is to be ready to deal with the problems that are happening now in the world health.
There are many news reports about the monkeypox, and which shows that it's very seriousness. For example, according to the BBC, monkeypox has been declared a global health emergency by the WHO, and this shows that how urbanization can increase the spread of infectious diseases. And the outbreak began in the Congo, but has now spread to the other African countries and beyond, driven by high population density and close human contact. The current outbreak involves a dangerous variant and with a death rate of up to 10%. In the year of 2024, there has been over 13,700 cases and 450 deaths in Congo. Experts warn that without the global action, the outbreak could get worse. Besides, in these news reports, we can see that not only in the affected countries, but also in some European countries have been affected by the monkeypox, which is a lot of cases can be found in the many parts of the world. For example, in the UK, the Clap 1B strain spread within the households, and in the US, the first case of this strain came from a traveler from the East Africa. In Thailand has also reported a case from a traveler, and in the Australia, we caught that it is the largest outbreak with the 433 cases since June 2024. And this case shows that how the monkeypox has spread worldwide and how serious it can be. The monkeypox spread through the close contact and can cause severe illness or death. We can see that the need for the global action to control the outbreak and protect the public health. And this highlights that the seriousness of the monkeypox, and it is a global issue.
My name is Sabrina. I will share about the trends of Mpox. In May 2022, an outbreak of Mpox appeared suddenly and rapidly spread across Europe. The Americas and then all 6 WHO regions, the global outbreak has affected primarily, but not only gay, bisexual, and other men who have sex with men, and has spread out person to person through sexual networks. Since 2022, there has also been an upsurge in Mpox cases and death in Republic. In some areas of the country, a new upshot for IB has been spreading person to person. The clay has also been reported in other countries. In this data, we can see that over 120 countries has reported Mpox between 2022 to 2024, with over 100,000 confirmed cases reported and over 220 deaths among confirmed cases. We can see that although the data in 2024 is slightly milder than 2022, there are still confirmed cases in various, which shows that the problem of disease still exists.
So, hi, in this part, I will share about why Mpox is a global problem. So, firstly, we have to ask a question. Can a single country solve this issue alone? The answer is no, especially some low-income country like Congo. Congo now have a services Mpox problem in this country. Because they don't have enough money, they have very low level healthcare system. So that's a very serious problem. And WHO have had to play a key role for guiding global response strategy. On the other hand, because Mpox, why Mpox is a global problem because it's already affect different country, not just a low-income country like Congo. On the other hand, some high-income country have already had some case like North American and European. You will see some case happen in French. So the last thing, why we think Mpox is a global problem because some world leader and acknowledge the severity of Mpox, especially the former American President Joe Biden. Now you can see the official update on Biden-Harris administration commitment to address the global Mpox outbreak published by December 2024. In this page, you will see the spelling for reference.
Hi, I am Jackie. In this part, I will explain more about why Mpox is a global issue. The Sustainable Development Goals were adopted by all United Nations member states in 2015 to end poverty, reduce inequality, and build more peaceful societies. Good health and well-being are one of the SDGs targets, which includes some small indicators, such as combating the epidemics of infectious disease and ending preventable deaths of newborns and children, which corresponds to the prevention of Mpox. Not only that, the United Nations identifies health as a global issue on its website. Regarding the Mpox epidemic, the United Nations also continues to update relevant information to increase global attention to the Mpox epidemic. Besides, the World Health Organization is a United Nations agency, also consider Mpox as a global issue. In May 2022 and August 2024, the World Health Organization General Director Dr. Tedros declared the Mpox a public health emergency of international concern. At the same time, they update the guidelines from time to time, calling on people around the world to prevent infection with Mpox and avoid causing an epidemic outbreak. In conclusion, urbanization and Mpox are global issues, which recognized and pay attention to by heads of states, media, and global organizations. These problems need to be solved by the joint efforts of all countries. This is our references. That's all. Thank you for watching our presentation.